In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
The prostate, our topic today, and our expert in the studio today is urologist Dr. Kurt Miller from here in Berlin. Dr. Miller, welcome to In Good Shape. We just saw one method to cure prostate enlargement, but there are other types of surgery.
Yeah, there's still what we call a traditional type of surgery with an electrical sling that removes tissue. Open surgery has almost completely faded away from the prostate stage, sort of, and there's different lasers. That's what we do today mostly.
So you're always going through the urethra and never...
In almost all cases, we can operate through the urethra.
Right. And why is it better than just doing an open surgery?
Well, it puts less strain on the patient, as if you do open surgery. Recovery is much faster. He's faster out of the hospital, less pain. That's the advantages.
Okay. And if you don't want to treat with surgery, I mean, most of my patients don't want to go through surgery, can you use any medication to get the prostate gland smaller?
There is medication either to reduce the symptoms that may be associated with an enlarged prostate, and there's also medication that indeed reduces the size of the prostate.
Okay.
Both is available.
So you can even do an ultrasound and you can see that it shrinks, that the prostate gland shrinks.
Yeah, well, you cannot see how it shrinks, but after 3 months, it may be smaller than when you started the treatment.
So you as a urologist, would you first try to use medications and then perform surgery, or how do you decide which
That's
kind
what's really done in most of the cases, unless you have acute retention, so you're unable to empty your bladder, you would, in almost all cases, start with medication, see how the patient is doing, and then only if that does not work, you would try to go to surgery.
And can you take those pills forever, or are there any side effects or dangers? This is what our viewer Soja Latgava from India wants to know.
Yeah, well, it's not, you can take it for a long time, forever, if you want. Some patients may experience side effects, and so they want to decide to discontinue these medications and opt for surgery. But usually the side effects are not severe. Okay. So yes, most of the patient can take it for a long time.
Okay, and when it comes to side effects, I always think about alternative complementary medicine, like natural remedies. Are there any plant medications you could use?
There is a huge numbers, particularly in Germany, many different of those drugs or compounds are used. Problem is, in none of the guidelines, there is conclusive evidence reported that this really helps. But anyway, I mean, you don't have side effects with these drugs usually. And so it's easy just to try and see if your symptoms get better.
And are there any dangers in not treating an enlarged prostate gland? Our viewer, Peter Kaufold from the Philippines, wants to know, as many of our viewers want to know, if there's a high risk of cancer developing in the enlarged prostate gland.
No, there's no risk. There's no correlation between enlarged prostate, as we call benign prostatic hyperplasia, and prostate cancer.
So even if the gland is big...
there's no risk.
And is it more difficult to find a small amount of cancer cells?
Could be that, in a larger prostate, by biopsies, by needle biopsies, finding a small cancer may be more difficult than a small prostate, yes.
I know the situation from my surgery hours. I've got patients coming to me where the urologist said, you've got a tumor and we just don't do anything about it. And they say, wow, I'm scared. So is it very dangerous to wait and see? This is what our viewer, Quenel Duffet from Canada, wants to know.
If you do the right patient selection, obviously, and we call it low-risk cancer, it's not dangerous. These patients are in the regular controls to look for progression. But if you look at the studies, and we now oversee these patients for a time span of 10 years and more, only a very small minority of the patients actually die from prostate cancer during that time, even if you do nothing.
And what kind of patients are eligible for this kind of procedure? Are this the more older patients?
It has basically nothing to do with the age. It has more to do with the aggressiveness of the tumor. And we know there is, as we say, tumor with a very low potential for progression. And it depends on the grading, on the staging, on the PSA, and on the palpation of the gland. And that gives you a picture where you say, well, your risk is so low, probably any treatment would be over-treatment in that situation.
Okay. And so if you want to do any treatment, what kinds of options you've got?
Well, we still have the standard option for treating prostate cancer, as we call localized prostate cancer, by either taking the prostate out, the whole prostate, or radiating the whole prostate. We're now in the stage where we start treating only part of the prostate. We call this focal therapy, and we use either heat or cold to treat particular parts of the prostate, which we now can better see as in the past, particularly as we now have MRI more often in use for prostate cancer.
Let's do some surgery hours for prostate cancer. We got a lot of questions here. We just asked them to you. We got a question from Zambia. Matthew Glynn wants to know, there's the PSA test. We just heard about this in the report. So how a reliable indicator is this test?
It's not a reliable indicator for prostate cancer. It gives you a risk assessment. And you may need more parameters to see if the risk is high enough to do further and invasive diagnostics. So in the hand of an expert, I think PSA is a good tool.
So as a screening tool, so you can go there to the doctor?
It's kind of, yeah, it's a early detection tool, I would say, yes. Okay. If you want to detect prostate cancer early, PSA is one way to go, and you need it.
Okay. Our viewer, Willy Kude, he's 85 years old and he lives in Brazil. And he told us that his PSA value dropped to a number of 2, which is normal. Considered it was previously higher after he drank a lot of water, 3.5 liters a day, he said. So what's the relationship between drinking water and the PSA test?
Well, usually there's no relationship unless you will say, I dilute my blood in a way that, you know, the PSA goes down. Gosh, and by the way, he is 85 years old, you mentioned. Yeah. So I would have advised him not to take a PSA anyway in his age.
Why is that?
Because his risk of dying from prostate cancer, if he had made it to 85, is so low that we generally recommend people over 75 not to make PSA screening anymore.
Okay. So, and drinking water is not good, or it's not healthy for your prostate gland. It doesn't affect it at all.
It may be healthy for other things, but it's not good for your prostate and not good to lower your PSA anyway.
Okay. But can you do anything good for your prostate to prevent getting cancer?
Well, we're not sure. I mean, if you have a kind of a healthy lifestyle from the time you're a boy and you eat the right things like more legumes, more fruits, not too much meat, not too much red meat, that may be helpful in reducing the risk. However, these data are not so
so it comes down to a healthy lifestyle.
Healthy lifestyle is good
for
anyway.
your health.
Yeah,
Professor Miller, thanks so much for being with us. You're in good shape. Thank you.
Okay.